Dr. Stepovich, I'd like you to talk about the reasons why adults get orthodontic treatment and how it can affect their life. Why sometimes it's a better choice than grinding down teeth, flipping on fake fingernails or tooth nails. Anyway, tell us why adults get it and when it's a good thing for them to get it. Prices, I mean.
Adult orthodontic treatment is usually one that the patient knows that they would benefit from orthodontic treatment. Occasionally, a dentist says to this patient, you know, you should really see an orthodontist for your condition before I do any treatment on your teeth. And they're really surprised. And they like hit themselves on the side of the head. Oh no, are you really saying that I need orthodontic treatment? Yes, that's correct. But usually the patients smile and position of their teeth they don't like, and they'd like to do that. And in some of the cases, the patient will come in and say, you know, doctor, I was not able to have orthodontics. My parents didn't have the means. I didn't have any treatment at all, and here I am, 35 years old, and I have the means now. I want to do something with my teeth. That's a story that you get a lot. Just didn't have the means, or they were in a place in the country, in the rural country, where there was not an orthodontist, and they just didn't have anything done, and now was the time to do it. So the adult orthodontics patient really is the driving force, and the motivation for that patient to come in, I ask them, you know, why are you coming to see an orthodontist? They tell me, and that's the story that they usually give me. And the varying treatments that adults require are some of them just have malaligned teeth, and it's just a matter of aligning teeth. Sometimes you need to remove teeth in order to take care of the problem. Other times there are missing teeth. They had lost teeth over the years, and the teeth have tipped, and they're almost laying at a 45 degree from the upright position, and they have a gum disease problem underneath the teeth. And in that case, a dentist would refer them and saying, hey, we have to take care of something here. These teeth are tipping more and more, and you're going to lose the teeth because of gum disease. So let's get to an orthodontist and get this taken care of. So many times there's a missing teeth portion of the treatment, but I think some of the patients, I finished a patient not long ago who did not know how to do anything on home care. They had a good health constitution, so it wasn't really disastrous as far as the loss of bone or receding gum tissues a lot, but they just had no idea what to do. Once we showed them how, they were really thankful, and away we went, and we made a healthy mouth and aligned the teeth. And the greatest thing that I got from this patient was, you taught me how to take care of my teeth, you know. And of course I told the patient, you know, you're going to be a healthier person.
Sure.
Everything's going to work better for you when you don't have bleeding in your mouth and sending these toxins all over your body. So it was, so there's a lot of varying reasons what happened with orthodontic care for adults, but the patient usually really wants to do it, and they really have a lot to do. You know, if there's just a few things to do for an adult, they dismiss that, and that's okay. But they have a tooth turned in the upper quite a ways, and the lower teeth are not aligned properly, and they know that something's wrong there, and there's a lot of treatment to do, and so usually the orthodontic treatment for adults are more involved and take longer to treat.
Okay. And as more and more adults, however, realizing that fact, and more adults straighten out their teeth. Maybe they had it as a young also, maybe they didn't. It doesn't really matter. Whatever happened, whatever they came along, instead of, kind of pulling out teeth or grinding them down and putting in veneers and implants, more and more people apparently seem to be using the alternative of orthodontic and or do a little bit of both. I mean, it's possible that a person still need an implant or two or may need a veneer or two, but at the same token, get some good orthodontic treatment. Seems to be an increasing trend, correct?
That's really correct. Well, if you do a combination, then you don't need to close all the spaces if they have missing teeth. Then we can upright the teeth, make everything work, the teeth work properly, and then you can put implants in, crowns maybe, and then even a bridge sometimes. But you can then handle it and make it a successful treatment. Otherwise, the patient wouldn't have successful treatment by just doing the dentistry. Okay. And so you can do half and half. Other times you do you completely close all the spaces. There is no implant needed, or a bridge, or sometimes, I don't think you'd eliminate crowns, but if a tooth has been refilled and it's broken down, and after the orthodontic treatment, after the teeth are aligned, then you put the crowns in. So this is a big part of orthodontic treatment for adults also, that you have to work with the dentist on what is happening.
Nice talking to you, Dr. Stepovich. Nice talking to you. That was very informative. So, to find out, I'm sure lots of people are happy to, they may be on the fence and go, oh, well, I don't think that's good for an adult. But, realizing what you said, many people are doing it, and it simply is a very, very valuable option. Thanks again.